The Department of Health has confirmed the first case of the new COVID-19 variant in South Africa, EG5 or ERIS. This comes after the World Health Organization, or WHO, classified ERIS as the latest COVID-19 variant of interest. Perhaps for more on this, we're going to discuss it further with Professor Guy Richards, Professor Emeritus in Critical Care at Wits University. Prof. Richards, good afternoon, and thank you for your time with us here on the SABC.
Thank you, and good afternoon to you.
All right, so at this point, with the news obviously breaking, we want to know how worried South Africans should be at this point, now that the variant has been confirmed in the country.
Well, I mean, it probably has been present for some time. Most people who develop upper respiratory tract infections currently are not testing. The anxiety regarding COVID has declined, and as a consequence, people aren't actually testing. Testing gets done primarily now for those people who are sick enough to be hospitalized. So it's quite probable that it has been circulating for some time before this, but has not yet caused an increase in the number of hospitalizations or in terms of ICU admissions.
So at this point, how much do we know about the variant? How different it is perhaps from the previous ones? What are also some of the signs and symptoms associated?
Well, it's not dramatically different from those that we have been tracking up till now anyway. So the XBB group are the ones which have been dominant up to now. This one has got a one variant or one mutation on the spike protein. The spike protein is what facilitates the virus, the ability of the virus to actually enter cells and to infect you. So it's not particularly different. And as yet, it doesn't appear to be any more contagious or necessarily any more severe in terms of the side effects that would occur. The most worrisome things would be if it caused COVID pneumonia. COVID pneumonia is what actually killed large numbers of people in the first and the second waves. And now we are seeing very low numbers of COVID patients in the hospitals and in the ICUs, and certainly on mechanical ventilators. So we're not seeing many at all.
How effective are current vaccines against this variant as well?
Yeah, the current vaccines will certainly give protection. Unfortunately, we don't yet have any of the new Pfizer mRNA vaccines available, and most of ours have expired. We actually need to have more of those available to us so that those people that are at risk, and that means particularly the elderly, the obese, people with diabetes, people who are on immunosuppressant medications for one reason or another, those are the people that would primarily be at risk and should be receiving an additional vaccine at this stage. But the vaccine will be effective and it will decrease the severity of the infection. And it's important that people maintain vigilance with regard to upgrading or increasing their vaccine protocols.
And so, Prof, to wrap up this conversation at this point, what are some of the precautions that South Africans or perhaps people entering the country could exercise to safeguard against it as we gather more information about it?
Well, I don't think any further precautions need to be taken. The COVID virus has been circulating and continues to circulate in our communities over the whole period of time since the last pandemic episode. So we accept that it has now become part and parcel of the viruses that you are exposed to, and the most important protective measure is for people to have regular vaccines to protect against the more severe disease.